This multivitamin iron capsule is used to treat or prevent vitamin deficiency before, during, and after pregnancy. It contains important building blocks of the body such as vitamins, minerals, and fatty acids, as well as iron and folic acid. It is especially important for women of childbearing age to maintain adequate levels of folic acid either through diet or supplements to prevent spinal cord defects in the developing baby. The recommended dosage is 1 capsule daily, and it is best to take it with food to help with absorption. Taking it at the same time every day can help you remember to take it consistently. When taking this multivitamin iron capsule, it is important to follow the directions given by your doctor or the ones provided on the product package. If you are taking the powder form, mix it in water before swallowing. If it is delayed release, do not crush or chew it. It is best to take this medication on an empty stomach, either 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you can take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as it may decrease its effectiveness. It is also recommended not to lie down for at least 10 minutes after taking this medication. Taking this medication regularly at the same times each day will help you get the most benefit from it. Some common side effects of this multivitamin iron capsule include constipation, diarrhea, or upset stomach, but these are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to talk to your doctor or pharmacist. It's normal for iron to darken your stools, but this is not harmful. This medication has been prescribed to you because the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you experience easy bleeding or bruising. While rare, a severe allergic reaction to this medication is possible. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. The best time to take this medication is usually with a meal to help prevent stomach upset. It's important to follow your doctor's instructions for the daily dosage and to take it at the same time each day for the best results. It's important to keep this multivitamin iron capsule out of reach of children, as accidental overdose of iron can be fatal in young children. If an overdose does occur, seek medical help immediately or contact a poison control center. It is important to inform your doctor or pharmacist about any allergies you may have to the ingredients in this product, including fish or soy/peanut. This product may also contain inactive ingredients that could cause allergic reactions or other problems. Before taking this medication, it is important to discuss your medical history with your doctor or pharmacist, especially if you have a history of iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication is safe to take during pregnancy when used as directed, and it can pass into breast milk, so it's important to consult your doctor before breastfeeding. In terms of the benefits of this medication, it provides essential vitamins and minerals, including iron, levomefolate, and DHA, which are important for overall health. The daily dosage and optimal timing for taking this medication will depend on your individual needs, so it's important to follow the instructions provided by your healthcare provider. It's important to be aware of any potential drug interactions that may occur when taking this multivitamin iron capsule. Some medications, such as chloramphenicol and certain anti-seizure drugs, may interact with this product and affect its effectiveness. Additionally, this capsule can decrease the absorption of other drugs, including bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of this product. It's best to consult with your doctor or pharmacist to determine the optimal timing for taking this multivitamin iron capsule in relation to other medications you may be taking. If you suspect an overdose or experience severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control centre. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to not share this medication with others. Your doctor may also recommend lab and/or medical tests, such as a complete blood count or checking your vitamin B12 levels, while you are taking this product, so make sure to keep all of your medical and lab appointments. Some brands of prenatal vitamins may also contain additional ingredients like calcium, zinc, iodine, or docusate, so it's always best to consult your doctor or pharmacist if you have any questions about the specific ingredients in your brand. This product should not be used as a substitute for a proper diet. It's important to remember that getting your vitamins and minerals from healthy foods is always the best option. Make sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. And always remember to consult your doctor for more details. If you happen to forget to take a dose of this multivitamin-iron levomefolate DHA capsule, take it as soon as you remember. If it's close to the time of your next dose, it's okay to skip the missed dose. Just continue with your regular dosing schedule and do not take double the dose to make up for the missed one. Remember, it's always best to follow the instructions provided by your healthcare provider. Make sure to store this medication at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it expires or is no longer needed, make sure to properly discard it. You can ask your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.